we just want to build power. Like, I think at the core of it is that our like Black and brown communities has been disenfranchised for a long time, and the way in which we take back that power is by coming together and actually like working together. So hi, my name is Julio. I am the co-director of community dignity campaigns with the Center for Popular Democracy, and I am part of the IRL team that deals with Bridgeport, Connecticut, and is working specifically with the impact that unstable hours is having in the community here in Bridgeport and the health of the children.
The project takes place in Bridgeport, Connecticut at Make the Road Connecticut, or the site is Make the Road Connecticut, which is a community organization in Bridgeport. Our project originally was conceived pretty narrowly to answer the question, or to think about the question, how do the work schedules of parents in Bridgeport shape access to both early childhood services and healthcare services for their children?
I think the change that has happened is that our first focus was more specifically around retail workers, and over the year when we started, we were like, well, it's really about Bridgeport. It's about people in Bridgeport. It's about immigrants in Bridgeport. And that really changed our focus, because it wasn't necessarily like retail jobs. It could be work as a day laborer. It could be childcare. It could be many things. But what we knew was that that work, in some way or another, even if it's like, if it's non-traditional work, if it's moms taking care of their children, that's work. Like, how is that affecting, how are conditions in Bridgeport affecting how people can have stability of work? And if they don't, what does that reflect on their children's health?
So the fact that an increasing number of jobs are ones where employees don't know what their schedule is going to be from one week to the next, and maybe even from one day to the next. And it creates a lot of problems in terms of having a regular income where you can plan a budget because you know what your check is going to be week to week. Planning healthcare appointments, finding childcare, all of those things, and not to mention leisure time for families. So there's a whole confluence of factors that affect people's lives, and scheduling is just one piece of that. So we have been working, we're talking about ways to talk about like how that all of those things fit together and the effect that it ultimately has on health. So it's scheduling and, like even if you fix the scheduling and you didn't fix everything else on that list, it would be an improvement, but it wouldn't be enough.
What IRL does that's so important is, the kind of research that we do is so important, is that it's asking a different question. It's asking a question, it's asking us to say, what are the important research questions that might not get asked if we only define science in this very narrow way?
Well, I think the collaboration between community and research is an important one. The work that community organizations do is made better by sound research.
So I think what research leadership is, any kind of leadership, is lifting up other people. And so what research leadership would be is increasing the power, ability, capacity of people to use research to their advantage to support the work that they're doing.
In a culture of health, every child has an opportunity to get a good education, to have a family life that is loving and caring, that they have enough to eat, that their parents have enough money to pay the rent.
So in a culture of health, people have good jobs. They can see their children, and they can schedule when they see their children. In a culture of health, we are able to go to a doctor without having to worry about if we have insurance or not. I think it's about like bare necessities that people have and how they are met.
In a culture of health, people are priority, the well-being of people as a priority. So it's not just a matter of patching things up so people can get back to doing the important stuff. The people are the important stuff.